Coming up next on Being Well, today's show is for parents who may be experiencing some frustrations when it comes to communicating with their child. Psychologist Dr. Angela Yoder will be my guest this week, and she'll be addressing several ways to make communication more effective. She's got some real-life examples to share that will hopefully strengthen the bond between you and your child. That's just ahead, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Alpha Care, specializing in adult care services that range from those recovering from recent hospitalizations to someone attempting to remain independent while coping with a disability, chronic illness, or age-related infirmity. Alpha Care, compassionate professional home care. Additional funding by Jazzercise of Charleston. Thanks for joining us for today's edition of Being Well. Today we're all talking about communication with children and parents, and I'm here with Dr. Angela Yoder. Tell us a little bit about your background before we get started.
Well, thanks for having me. First off, I want to thank you for that. I have worked as a counselor and then later as a psychologist in 3 different community mental health agencies, and I worked primarily with children with a specialization in play therapy, so working with their families. And now I'm very honored and privileged to be able to teach play therapy among some other classes for my graduate school and clinical counselors.
And which department are you? You're here at Eastern.
Absolutely.
Which department are you in?
I'm in the Department of Counseling and Student Development.
Okay, so you spent a part of your career, as you said, counseling parents and families and children. Looking back at that, what was one of the most common communication frustration that parents would talk to you about? I
would say one would be having developmentally inappropriate expectations of their children. So parents may come in and complain that their children weren't doing something when really they weren't capable of doing that. So for example, expecting a 2-year-old to sit through a Disney movie while they got a bunch of work done, and so a 2-year-old really doesn't have that kind of attention span to sit through a movie. And then secondly, I would say limit setting, that parents struggle to set limits in ways that children would both understand and follow through with, and that was a real source of frustration for parents.
Before we really get started, it sounds like a lot of this communication, this frustration starts because cognitively, children and adults are very different, and I think you need to explain that a little bit more.
Absolutely. So the majority of adults the majority of adults are capable of formal operational thought, which allows them to think abstractly about concepts that are not in front of them. So to reflect on motives, to think about hypotheses.
Like, why did I do this? What should I have done differently? That's what we as adults do. But children don't.
That's right. So children in the pre-operational developmental stage, so approximately ages 2 to 6, and those in concrete operation stage, which would be approximately 6 to 7 to 11 or 12, really are much more present focused. And so they think about what's happening right now, which is one of the joys of being with them, and also can be a source of frustration. So for example, when parents say it's time to go, that's why a child may throw a fit, even if they're going to the Dairy Queen to get an ice cream afterwards, or they are going to get to go to the park again the following day, that children are really just thinking about how much fun I'm having right now. And then also that children do best communicating in concrete ways or in the present with objects right in front of them. So play really is their very first language, in a way that they process things, in a way that they work through problems that they're having, whereas adults tend to talk about problems that they're having.
Kids don't sit and analyze problems and reflect upon what they did or didn't do.
That's right, but we often expect them to.
Yes, we do.
Right? So parents will say, why did you do that? And then they're often frustrated that the child shrugs their shoulders and says, I don't know.
So let's use that as an example. If a parent is frustrated because they ask their child, why did you do that? And they don't get this answer, what might be a better way of approaching that subject with them to maybe kind of get what it is
you're wanting the
Right.
answer.
So typically I recommend what's called therapeutic limit setting, and it's part of child-parent relationship therapy, where you would kind of back up and intervene earlier. So in other words, we're really good at telling kids what not to do, but often what we fail to do as parents and caregivers and teachers is to tell them what they can do to meet the need or the feeling or the wish or the want that they were having in the first place. So we say things like, stop it, quit doing that, and we repeat ourselves, and then understandably we get frustrated when children don't cooperate. So first of all, to think about how we are setting limits.
Okay, so instead of saying, don't do that, don't write on the wall, what's a better way to approach that then?
So we would start out with, there's an acronym that will help parents remember, and it's called the ACT, Therapeutic Limit Setting Model. So A would be to acknowledge the child's feelings, wishes, or wants. And that really is an important part of parenting, is to become a detective and try to figure out what need your child is meeting. So for example, your child may use a toy to hit someone else because they don't know how to use it, because they're trying to get the other child's attention, or because they're angry, or for a variety of reasons. So figuring out what the intent is will help you to target alternatives later.
Okay, so that's A. What is C?
C would be to communicate clearly the limit. So oftentimes we set limits in ways in which we know what we're talking about, but kids do not. So we say things like, I'm not sure if that would be a good idea. And the child hears, that may be a good idea if you can convince me. And so kids will often respond by arguing, or we say, be careful, which children really don't know, what does that mean, be careful. And so to be very specific about the properties of maybe the object that's involved. So for example, that sword is not for hitting your sister with, or that flute is not for hitting the dog with.
So again, it's that we use more abstract speaking, and kids need concrete. When I was in your office the other day, you talked about this example of writing on the wall.
Yes.
And I want you to explain that, because that kind of made a lot of sense to me.
Yeah, absolutely. So rather than talking about, you know, I don't know that you could do that in here, or that might not be a good idea, or Johnny, you can't do that, to say the wall is not for writing on. So you're talking about the actual properties of the wall. So it's not personal. It's not that you are mad at the child and they're just not going to allow them to do that, but you're talking about the properties of the wall. And then the T would be to target appropriate alternatives, so that you're able to say, you know, you could choose to write on the paper, or you could choose to write on the chalkboard instead.
Okay, but if you say, I brought this up to a friend of mine who has a child, and she says, yes, but my kid would say, oh, but this wall might be okay. So you really need to be very specific.
Very specific,
Like
absolutely. Not just that wall, but walls are not for writing on.
So you had talked about setting limits. I want you to get a little bit more into that.
Well, I think I have a few tips that I would give to parents. One would be to use the child's name. So, you know, and a lot of us can remember fondly or not so fondly our parents saying our first and middle name, and we kind of knew we were in trouble. But to not say it necessarily in that way, but the younger the child, the more likely saying their name is going to get their attention. The other thing is, when you target appropriate alternatives, especially for younger children, that you kind of use your pointer finger and that you point over where the other choice lies. So for example, if they're writing on the wall, that you point over to where the paper is, or where the chalkboard is. And what that typically does, especially for kids in pre-operational stage, is that their little eyes follow your finger. And so they're already kind of moving in the right direction. And then lastly, I would say to be patient. So
Which is hard when you've had a long
really-
day, and maybe you're a single parent and you've got all this going on. Patience is hard.
It really is. I think, and I can really relate to that, right? That it's such a struggle. But the word discipline actually comes from the Latin word disciple, which means to teach. And so if parents can keep that in mind, that the way in which they resolve the conflicts that are happening in their home helps to teach the child how to resolve conflicts in their own life, that helps them to slow it down a little bit. And really, that kind of extra attention and time pays off in the end. So for example, if you get into an altercation with your child and things go awry and you get very punitive with them, chances are the rest of the evening is probably going to follow suit. And so if you can take 5 extra minutes to address what's going on and allow the child to make the choice themselves, then that really pays off. So not intervening too quickly, but to say, Zachary, I know that you really want to use that as a sword and hit your sister, but that toy is not for hitting your sister with. You could get her attention by giving her a hug, or you could give her a high five, and then waiting and allowing the child to really work through their own struggle.
You brought up a key word, and that's attention. And we all know that children love attention.
Absolutely.
And you had given an example of how to deal with, say you're on the phone talking to somebody, and your child is like, Mom, 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 Mom. What's a better way of handling that to resolve that so you can do what you need to do?
Yeah, so typically young children have a tendency to do that. Everything's going fine. I know my own kids do that. The minute that you get on the phone, that's really when they want to know, are you going to pay attention to me? Am I important to you? And so there are rarely phone calls. They do exist, but there are rarely phone calls that you can't take 30 seconds out of the phone call to address your child's needs. And so, you know, one of the things that we don't do as a society is really pay a lot of attention to kids in a very present, focused way. We're kind of attending to them while we're doing other things, or checking our text messages, or Facebooking. And so what I would recommend is a technique used by Gary Landreth called the 30-second burst of attention, where you tell your friend or your coworker or whoever you're speaking to on the phone, I need 30 seconds to address my child. Is that all right with you? And most people will say that's fine. This 30 seconds is not very long. And to actually put the phone down, to get on the child's at eye level, right, and to look them in the face and say, I know that you need my attention right now. So what is it that you need from me? You have 30 seconds. And most kids will kind of disarm them. Yeah, a lot of kids forget what they wanted you for, but to go ahead and remain there, you still have 20 seconds left, take your time, and to really be present for the child. And really that kind of meets the need that the child has, and typically they stop. Most parents don't have to do more than one 30-second burst of attention.
So what about those scenarios where you're at the grocery store and your child is out of control because they want something and you are in a hurry and we don't have time for that, and it's meltdown ensues?
Yeah. Well, first recommendation is that old adage, an ounce of prevention is worth a pound of cure. And so we know what our kids' hot spots are, the behaviors that they have that drive us nuts. And so making it playful, trying to figure out what need is being met. So for example, if they're bored, that's different than them being tired and hungry. And so making sure those needs are met, and then talking with them about that behavior before you go in the store. So I know that you like to ask for things, and that's not okay. And so finding something that will help fill their time, or also offering them some time with you at the end if you choose to use your good behavior in the store and not ask for a toy. Then you choose to have 10 minutes with Mom when we get home and play.
What about, we talked about praising appropriate behavior.
Yeah.
Because often we tend to focus on the bad behavior and make that the focus.
Right. Life is stressful, and parents are stressed out. They have a lot to deal with. And so typically when kids are being good and quiet, we kind of let sleeping dogs lie, and we go and get some things done. And so unfortunately, sometimes kids learn that the way to get your attention is to engage in negative behavior, because that will engage you, right? And so I like to recommend catching them being good. So, and kids really enjoy a playful approach to this, sneaking up on the couch and jumping out and saying, I caught you, and then following it by, I caught you being good, and being very specific about what the child is doing that you appreciate. And so that kind of prevention, where you're noticing positive behaviors that your child engages in, help keep that relationship healthy. And so the better the relationship is between you and your child, the more internally motivated they are to comply with your request.
So what about, and there's parents out there that probably use the timeout. In your opinion, in your professional opinion, is that effective or not?
Timeout can be very effective,
Okay.
but parents really need to think about, again, what need the child has when they're misbehaving. So, for example, a child who is hungry and tired, it's probably not going to be super effective with. But a child who's acting out to be a goofball and get attention, or a child who's overstimulated may really benefit from a timeout.
But like timeouts, effective timeouts, not using 8 of them through the day.
Absolutely. So any intervention you can overuse and it loses its power. And so it's really important to sit back as a parent and caregiver and kind of evaluate the situation. If a child perpetually engages in the same behavior, to kind of look at your strategy and see what is it that the child really needs from you, and maybe you've misunderstood their intent.
You had also talked about you have to set, if a child is misbehaving and you say, we are leaving the party, can they figure out that, well, they're really not, that's too extreme of a, or I'm pulling this car over.
Absolutely.
Whose parents really did pull the car over?
Absolutely.
I mean, my mom said that all the time, but the car was never pulled over.
Right.
But that could be kind of ineffective.
Absolutely. So parents need to say what they mean and mean what they say. And the more that they don't mean what they say, the harder it is to break kids of bad behavior problems. So in actuality, intermittent reinforcement actually strengthens a behavior. So if you attend to a behavior and follow through with a consequence, say you do it 5 out of 6 times, it's that one time that you don't follow through that the child kind of remembers. And so it's sort of like if you go back to your Psych 101 classes and the rats that push the lever to get the pellet, they learn that they push it 5 times and get a pellet, and if you reward them consistently, of course they learn the behavior, but really what makes it most strong is when you reinforce them intermittently. So every once in a while you don't give them, then they'll actually press the lever more. And so that's why kids will, that one time that you gave in at bedtime, they push you so hard the next time.
So even though cognitively they don't think abstractly and they're in the present, they're smart. They're smart little buggers. They can remember these things.
Absolutely. And it's not necessarily always a conscious thing.
Right.
Like I'm trying to get back at mommy, but it's just like classical conditioning, really.
So what about, I know a lot of parents out there probably, it's 5 o'clock, everybody's home. It's just this whole chaotic stew of things happening, which is a very stressful time. What advice do you have for parents on how to get through that, 5 o'clock, and why is the 5 o'clock or after work, after school such a tenuous time?
It absolutely is a rough time, and it's a heavy traffic, behavioral problem time. So it's a transition for everybody. Everybody's coming home from work, maybe daycare. Blood sugar levels are low, probably because it's time to eat. And parents are coming from one environment to a next in which they have demands on them. They need to get supper, they have to get bath, and so everybody's feeling a little stressed, a little off. And so creating rituals can be really helpful that kind of help the transition. So keeping in mind your child's individual needs will help as well. So for example, some kids need a little quiet time just to themselves, where you can give them a choice to color or read a book, whereas other kids really need you and they need some interaction. So carving out 5 minutes before you jump in to fixing supper can go a long way. Or looking preventatively, maybe the child needs a snack at 4 o'clock and they're not getting that.
So parents may say, Angie, this sounds like great advice, but I do not have time. My day, I'm a single parent, I am busy, I have 3 children. I don't have time to sit there and do this one-on-one.
Absolutely. Well, I mean, it's really it's something that a lot of parents struggle with. But that 5 minutes gives you more in the long run and frees you up. And so I would say do whatever you have to do. If you have to get up 5 minutes earlier, if you have to come home 5 minutes sooner, whatever you can do to look at your day, try to fit in ways that you can spend quality time with your child. It doesn't have to be long periods of time. And what you find is that when you do give 5 or 15 minutes where you're really tuned in and present focused, your child and you have a better relationship. And so actually they act out less, and having that strength, that the bond of that relationship helps.
What about apologizing? We're talking about parents apologizing to their children.
Yeah. One of my favorite play therapists has a rule of thumb, and it goes, what may be most important is not what you do, but what you do after what you did. And so we all make mistakes, but the good news is that we can recover. And so apologizing is so important. And I know that as a parent that I mess up, and it's hard. I think parents a lot of times think if I apologize to my child, I'll lose my authority and they won't respect me. But really, we don't do a great job in our society of teaching our children proper ways to apologize. And parents and caregivers are the most important role model that their child will have. And so if you can role model how to recover in a relationship when you've blown it, that's a really powerful lesson for a child. And again, it helps that relationship if you can be vulnerable and admit that you've made some mistakes.
And it doesn't, quote unquote, weaken your position as the parent.
Absolutely. It strengthens the position because it's ridiculous to think that we don't make mistakes. Everybody makes mistakes, and kids know that.
So we have about 3 minutes left. I want you to kind of give us our parents out there that are watching, some rules of thumb to maybe think about as they're going through their days and weeks and years with their children.
Yeah, I love the rules of thumb because they kind of help us, they help ground us and guide us when we don't know what to do. And in parenting, there's a lot of times that it's confusing and you don't know which way to go. I would say to take your time. So if you're not sure what to do, then you can stall for time and tell your child, I'm not sure how to respond to this. Mommy needs a little bit of time to think about it. Or if you're an auntie as a caregiver or dad or an uncle, that you need a few minutes to think about it, and that's okay. Gary Landreth also has a rule of thumb in child-parent relationship therapy called focus on the donut, not the hole. And so in our busy, stressed out world, sometimes we have a tendency to focus on the negative about our child, and it's really, really important to get back to what you love about your child and to tell your child, whether you write them a note in their lunchbox pointing out a positive characteristic they have, or you pull out some old photos and talk with them about that. Those are really, really important things to remember, the good about your child, that the problem that they're having is one piece of them, but there's a whole human being there.
So I love the focus on the donut, not the whole. Did I get that right?
You did, absolutely.
Right. Anything else as we leave today? I think you've given some great advice for parents that you know, in theory, I'm not a parent, so it's also easy for me to say implement this, but it sounds like just taking that little extra time in the long run can help.
Absolutely. Gary always says that you can't give away that which you don't possess. So as a parent, if you're looking and all of your interactions with your child seem negative, take a step back and think about what it is that you need as a parent. Maybe you're not getting enough sleep. Maybe you need more connection in your life. So if we're trying to train our children to be thoughtful, considerate, compassionate people, then we have to have those qualities ourselves, and that can be tough. And I think lastly, when you're not sure what to do, always do the thing that helps preserve your relationship with your child. And if you don't and you blow it, be sure to apologize.
All right. Well, Dr. Yoder, we'll have to have you back again when we can talk about teenagers, because that's a whole other set of things. So thank you so much for coming by, being well today. We appreciate it.
Thank you.
Acne, it's a teenager thing, right? Well, it's an adult thing too, especially for women. A quarter of women in their 30s get it, and it can plague people for decades. Experts at Mayo Clinic have tips on how to handle adult acne.
We see people who had never had problems with acne in their adolescence, but developing it in their 20s and 30s and 40s.
Mayo Clinic dermatologist Dr. Mark Davis says the medical world does not know exactly why adults get acne, but they do know how to treat it.
We use all the same things that you use for adolescent acne. So we use topical treatments and then oral treatments if the topicals don't work by themselves.
Dr. Davis says start with over-the-counter topical products that have benzoyl peroxide in them. Your doctor can also prescribe topical retinoids. If after 3 or 4 months your acne is not improving, the next method of attack is to add on prescription oral contraceptives or antibiotics. If after a couple more months there's still no improvement, there are a number of treatment options, including what's called spironolactone. In very rare cases, your doctor could prescribe isotretinoin, which is very effective, but it comes with side effects such as birth defects.
And if you've got a big event coming up and you suddenly get a big pimple, steroid injections can work very well, but they're risky.
Because injecting a steroid can make that area of your skin become what we call atrophic. In other words, you might get a dimple in your skin instead of having the bump on your skin, and that can be permanent.
Dr. Davis also says no matter how clean you keep your skin, acne still happens.
Very difficult to prevent acne.
He suggests using a gentle soap, but when pimples do pop up, most adults can blot out the blemishes within weeks to months when armed with the proper tools of treatment. For the Mayo Clinic News Network, I'm Vivian Williams.
That's all the time we have for this week. Thanks for watching. We hope to see you again for the next edition of Being Well.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. AlphaCare, specializing in adult care services that range from those recovering from recent hospitalizations to someone attempting to remain independent while coping with a disability, chronic illness, or age-related infirmity. AlphaCare, compassionate professional home care. Additional funding by Jazzercise of Charleston.